cancer.
So as a young surgeon, Casey, would you accept an AI guideline that pops up in your EMR when you put in the variables of this patient, like prostate cancer, aging, osteoporotic fracture, T-score, yada, yada, yada? Would you accept that? Would you this is very cool what you put together here, but would you, as a young surgeon, accept that? Would you find that helpful?
So, I like this mantra of trust but verify. And so it's kind of, same thing maybe when the internet was coming out, right? And people are like, all right, go look this up in encyclopedia and then tell me what you think the right answer is, right? I think this is a super useful tool. This is a snippet from just a cursory search on open evidence. And so I believe it indexes like more major journals and things like this. And so it's helpful to see at first, but obviously have to do a little bit of verification here for these things.
So Raj, back to you. So information is there. This is really cool what Casey did here. How can we popularize this? How can we reach the public better? How can we kind of make sure that the public is interested in what we're thinking and will actually act on it? How can our colleagues also be convinced to use this kind of evidence?
Yeah, so there are various techniques. I feel the best technique currently as individual surgeons we can do is collaboration. We can collaborate with each other and spreading knowledge among the colleagues, followed by if person A is having good knowledge and he wants to spread this knowledge with the help of social media, he can spread it to about his followers. But if he collaborate to 5 other people, that information will spread 5 times, even 10 times. If the same information, if I go and present on any society podium, that will spread again to the big general physicians and the practitioners. But to spread to the general population, I feel the online education is very well retained, very, very well seen, and it spreads globally and very quickly. It's real time. And there is no cost involved. I'm talking to you sitting in Australia, and my viewers, your viewers are seeing it across the globe. So I feel social media is the best way to kind of create this awareness. It's a simple message. What he told is it's a very, very simple message, and all it needs to be spread very well because it's evidence-based. That's all I feel personally.
Okay, last but not least, we have Hagai for a final 5 minutes. Thank you, Casey. Great case, great discussion also. And Hagai Amsterkhan is from Israel, and he has a patient with myelopathy. And this is just a very quick see it and
very well treatment, because it's evidence-based. That's all I feel personally.
And okay, last but not least, we have Hagai for a final 5 minutes. Thank you, Casey. Your thoughts on the myelopathy scourge and the lack of recognition of myelopathy will be the main question that I'll direct you on. Are we able to pull up your...
Yeah, it's loading. I apologize for the... There it is.
So for me, myelopathy, I'll just editorialize whilst Hagai is pulling this up, is one of the most poorly taught conditions that should not be so under-recognized. So Hagai, take it from here.
Yes, so good morning. Thank you for the introduction. I'll try to be fast. This is a 30-year-old patient. He came into the ED just recently, and we were consulted. He came in due to a new weakness. He has a long history of alcohol abuse, about 20 drinks a day for the last 20 years at least. He stopped drinking about 6 months ago, so he's kind of trying to change his life. He stopped drinking, he got married, but he has liver cirrhosis, he has pancreas insufficiency, he has kidney failure, and he became acutely weak over the last week, almost bedridden due to lower extremity, both weakness and unsteady gait, and very poor control of mostly his right arm and hand, with some weakness on his left side as well. That's the physical examination from his chart. When I saw him pre-op, he was even weaker, and like he had very poor control of his right hand. He was barely functional, and he was basically bedridden. He couldn't even walk with a walker, and a week before that, he was walking independently. That's the CTE had done over at the ED. We can see advanced degenerative changes with kyphosis and stenosis of the cervical spine. And on the MRI, we can see again severe kyphosis centered around C4-5, severe stenosis C3-4, and core changes going down, even down to C5-6 and C6-7, but not as bad stenosis at the lower levels. So most stenotic levels are C3-4 and C4-5. So just a quick summary. This is a 60-year-old man, significant comorbidities with severe myelopathy, persistent cervical deformity. And now the question was, do we go all in? Do we try and fix the entire deformity? Do we try to treat his acute symptoms? How big should we go with a pretty sick patient?
So, Raj, for me, the big point here is, as identified, myelopathy and the lack of recognition. All of us know about spinal cord injuries and Christopher Reeves, etc., and his tragedy, but the fact that people can destroy their spinal cord just through bad habits like alcohol and secondary organ damage seems to be just not recognized. So myelopathy recognition, I know you had a long background in pediatrics, but is this something that's well taught? Can we kind of improve the general awareness of amongst the medical colleagues to better recognize myelopathy?
Yeah. So myelopathy is a condition where the clinical features, the clinical signs and symptoms are very well picked. Even without the imaging, if someone comes on with all these signs and features, we can very well pick it up in the clinic itself, right from all the signs we teach in our medical books or examination, like Hoffman sign, clonus, jerk. So if we pick up that very well, we can image them well, we can diagnose them early. And most of the literature is going towards a trend where there is a compressive myelopathy. The best available management option is decompression. And we'll be touching on that a little bit later during my talk. But compressive myelopathy, cord signal, I always explain it to my patients this way. If there is a big stone on your neck, or if there is a big stone on your foot, the best way to remove is what? So they will answer themselves that, yeah, by removing the stone. The same way I explain that, yes, your spinal cord is compressed. All it needs is good decompression. And they understand very well. If you make them understand in the simplest language with a good message, they are more likely to undergo the treatment rather than what the information, what the knowledge they had 20, 30, 40 years ago that cervical spine injury or myelopathy is non-recovering and the surgery won't be successful. So all these conditions, all these points are very important, and the myelopathy is treatable, and we can really give good results with the surgery in these compressive myelopathy patients.
So in the interest of time, Hagai, fast forward what was done and what will have to be done.
Yeah, so we went for the minimal option, and this patient CDF at C3-4 and C4-5, just to try to minimize surgical invasiveness and the perioperative risk. Following surgery, he went back to walking. He regained 99% of his strength back in his right arm and hand. He was very happy. He was actually discharged the day after surgery. Will he be back? Probably, but I don't know. Yeah. So
amazing neurologic recovery from a smaller surgery. Looking at that preoperative CT scan, this is not my patient. Raj, would you suggest that he have a posterior surgery also? I mean, he has severe facet disease. If you look at any corollary scoring systems like the SITE score that I put into the chat, or extrapolate from the trauma literature, this is a 3-column injury, right? So, I mean, this is a highly globally unstable C-spine due to a variety of intrinsic destructive processes. Any thoughts on what will be necessary for this patient, how this patient can be served best now?
Yeah. So sometimes I feel we overthink about sagittal deformity sometimes. And it's not always mandatory to do global in these scenarios. If it was a mechanical instability or a traumatic fracture dislocation or a severely unstable spine, yes, the global instrumentation, global fusion makes a lot of sense. But it's a degenerative condition. Uh, with the anterior fusion, the lordosis is achieved with the cages and the plate. And it looks really beautiful. And he's been with that condition for a very long time. And suddenly, with this all debilitating condition, with organ failures, if you try to go global, we will not have the results as good as we think. So he recovered very well. The anterior is serving its purpose. I will just stay with the anterior. But if the scenario was different, if it was significant mechanical instability in terms of the traumatic fracture or dislocations, then I will try to go global 360-degree fusion.
So I personally would have probably gone a little bit lower. I would have not done big inner body grafts, but a 2 or 3 level fixation below would have not added much invasiveness, but would have given me a far better caudal anchoring point rather than these shorter screws. I'm very concerned that this will just basically pivot and avulse through that, what's that, 3, 4 at C5. It'll basically just fall forwards. Alternatively, when the patient's medically stabilized, I'd probably do a C2 to T2 fusion, but those are my thoughts. Only time will tell, but a very dramatic early recovery was cool. Obviously, this patient was a ticking time bomb, and again, great job getting him out of the trouble early on, but I hope that there'll be a lifestyle change, an intervention, and a strong recognition for a possible secondary posterior surgery. This is my thought. Good, thank you. So now, thank you, Raj, for going through our cases, and hopefully to serve us some talking points. It's a great pleasure for the first time to have Dr. Raj Sakhrekar here. He is a global spine surgeon, and his training involved Canada, Australia, where he's now practicing in Perth, South Korea, the US in terms of San Diego, Germany, and India in terms of Mumbai. He has already in his short career become a global fixture, and he's the godfather of OrthoTV and SpineTv, and education is his passion. He's published extensively. I think it's about over 100 articles already. And he's also founded the Global Spine Care Foundation. So we all recognize his passion for spine care and popularizing its content to our patients and to our spine surgery community around the world is one of his missions, and he's done a terrific job with this. So it's a great honor to have you here today, and tell us a little bit more about how we can kind of, as spine surgeons, become better at popularizing a message and not just hiding in operating theaters.
Thank you very much. Really great honor and privilege to be coming and speaking on Seattle Spine Foundation. Personally, I'm a big fan of Professor Jens Chapman. Been following him for over years, and it was really a fan moment when I met him a few years ago. And that time we discussed a lot of things, and we discussed a lot of kind of close thought process and all these things. So he invited me for this talk, and I discussed our passions, and I'm here to talk on importance. I'm good to share my screen. Yeah, can you see my screen, everyone?
I love those glasses. Why didn't you wear them today?
Yeah, I broke them.
Oh.
Yeah. So today I'll be talking on involvement of spine surgeons as a drivers of public health and awareness. So I'm currently working in Royal Perth Hospital. It's a tertiary level hospital, as well as I'm, as we discussed, privileged and honored and lucky to work in 4 or 5 continents, including Canada, Australia, Germany, South Korea, and India, and other places. It was always my passion to spread the awareness beyond the operating rooms with the help of all the means we have currently with the social media. So just to start with, this is Margaret. She had osteoporotic compression fracture. And to present with, she had back pain and all the symptoms of osteoporosis. But in her 90s, 60s, and 70s, and 80s, and 90s, she heard that spine surgery is a failure. It doesn't work. So she even if the surgeon's advises to go ahead with the surgery, fix the back, uh, she was not willing for it. Over the period of time, the kyphosis increased, leading to the neurological compression and neurological deficit, and she suffered from paraplegia. Okay, so at that stage, we decompressed her and fused her, but as we know, the spinal cord injuries are irreversible. She already suffered from the non-reversible sequelae of the spinal cord injury at the thoracic level. Another case, this is again 70-year lady, some Emma. She had severe lumbar canal stenosis, like pinpoint canal, we call it by Shiza's D. She was told surgery to decompress the canal, but again, she heard in 1980s and 90s and early 2000s that spine surgery doesn't work and she should try to avoid the surgery. The sequelae of lumbar canal stenosis happened, and she lost the power over the bowel and bladder as well as lower limbs. Another case, Sam is a 54-5 male. He worked lifting heavy weights on his shoulder and neck in a labor driven industry. He developed the neck pain as well as the cervical myelopathy. He, considering the compressive myelopathy, he was advised surgery, but again, same thing, due to lack of awareness, he tried to avoid surgery. Over the period of time, the compression became more and more, the myelopathic changes became more evident, and he suffered from quadriviruses quadriplegia. So all these things were very well treatable, very well preventable, but only because of the lack of knowledge, lack of awareness. These are just not three stories, but across the globe, I have seen it's not just developing countries, but even the developed countries suffer from these scenarios and suffer from this problem. So, as a spine surgeon, it's not our jobs to operate the patients which will come to us in our clinics and operating rooms. It's our social responsibility. It's our big work to do in these scenarios to spread the awareness, to prevent the disease, prevent the treatable conditions which we could avoid, as well as create more and more awareness. To talk about the reach of the social media, this is article from Forbes. It says about 4.9 billion of the people were using social media in 2023, and by 2027 about 5.85 billion out of about 9 billion population will be using the social media. So you understand the magnanimity of it. So why, as a spine surgeon, we are not using the social media to create the awareness? An average person use about 145 minutes every day. What's the purpose we should have? Like, the main purpose I see is to create and spread the information, dispel the misinformation, create and optimize patient to patient, patient to physician interaction, encourage more and more learning with the evidence based studies. These are the mottos we should have to create more awareness and avoid these conditions. A lot of literature has been published which discuss that online studies are more and more effective than the written text for the general population. As we are surgeons, physicians, we are used to read articles, but not much as in the general population. They, in their evening after the post work hours, in their were sitting lazy and watching videos and reels scrolling. If these videos come up about the more education, more information, they have shown to be more retention and found to be more and more effective than just the written text in the books or the article. The scenario is a little bit different in public sector as well as private sector, but still more than 80% of the patients, before they see you in your clinic, they study about you as a doctor, they study the hospital, they follow all the information about their condition, what's their probable diagnosis. So all these things they search online, they look for you, they look for your hospital, they look for the condition, and all we need to do is create awareness about their condition, what it could prevent, what are the treatment options available, what are the success rates available, what is the post-op recovery is like, how the rehabilitation will work. All these scenarios will reach to this 80% of the patients or general population who's looking for you and your content. We should combat the misinformation. We should facilitate the scientific discussions among colleagues as well as our general patients, and improve the scientific based learning, micro learning through the recent publications and article. As we discussed, the social media currently has a global reach. If I can speak to Dr. Professor Jens Chapman sitting in Australia. The same been seen in North America, in Europe, and in subcontinent Asia, Africa. So it's really has a global reach. What you're talking, what you making a good sense, what the evidence you're sharing is being spread across the globe. And to be honest, it doesn't cost money. I'm discussing with all you guys. It requires very less of, at least very minimum money. So all these factors considered, we should use the power of social media in healthcare to create the awareness. Again, as per the Forbes article, about 6 billion population will be using it. It's will be the fourth necessity. We call it food, clothing, housing, and the social media and the online education will be the fourth need of the hour, I personally feel. This is a very important article published in 2023 in Neurospine by the Hospital for Specialist Surgery. They studied the content, the quality of the content on the social media, and they seen that the layperson have put most of the content about the spine conditions, and the quality of that content is very low. And we as a healthcare professionals in putting these contents are at very low level in terms of ratio by content by the layman versus the professionals. As a spine surgeons, we are way behind with our other colleagues like dermatology or plastic surgery or weight loss physicians or physiotherapists or chiropractors. They are way ahead in creating the knowledge. They're way ahead in putting the good video content and creating awareness and spreading all this information to the patients. So we need to kind of build up our game, make ourselves more visible, share this knowledge, and spread it among our colleagues as well as the general population, and share about the modern spine surgery and the success of spine surgery. One small message, this is I always speak and talk about vertebral artery aneurysm, and we see a lot of manipulations been done on the neck, and vertebral artery aneurysm and manipulation has shown to have devastating complications, right from stroke till paraplegia, quadriplegia, and even deaths. All you need to create awareness that don't manipulate your back strenuously. If you spread that awareness more and more, the ratio of 1 into 20,000 manipulation and stroke and death will drastically reduce. This is just preventable thing which we think and could be thing of the future. Again, we need to create more and more awareness about spine health, about the conditions, what are the disease, the signs and the symptoms, what are the imaging options available, what are the treatment options available, how it can be done in more and more better way, and the ways we can prevent this disease, as well as what are the rehabilitation options available for it. So this is about why we make it. Now how we make it, I will talk a little bit. As a professional, we should try to avoid spelling mistake, grammatically incorrect spellings, try to avoid negative words like kill and blood and all these things. Avoid clinical picture which are kind of showing blood or wound. They are kind of flagged by your algorithms of the social media. There is a lot of music infringement. So if your own original voice is there, that's good. So all these things you should do to create the awareness. And most importantly, we are doing this not for the likes, not for the comments, not for the views. We are doing this for more and more creating awareness. That should be our motto. That's what I personally feel. So choose your platform based on your audience. If your audience is more of a Instagram based, share more content on Instagram, be more active on Instagram. If your audience is or your patient population is more on Facebook, use more Facebook or YouTube or LinkedIn. LinkedIn is, I personally feel, is for professionals, but still all these platforms are very useful. And depending on your audience, you choose the platform to put the content. Consistency is very important. If you put one content in once in 3 months or 6 months, it won't have as good impact as you if you post consistently, like one post a week or something like that. Always follow ethics of always follow institutional policies. Create engaging content. Always there are always challenges. Always try to avoid trolling your colleagues, trolling laymen's or those who are tried creating not so knowledgeable content. Try to avoid trolling them, but create same time good knowledgeable evidence-based content. There is algorithm that it says a longer time duration content, video content won't work. So try to be as short as possible. If less than 90 seconds, that will be good. Maintain professional boundaries whenever you're making content as a healthcare professional. Keep realistic expectations. As I told you earlier, don't go for likes and views. Your main message is to create the awareness. There are also challenges. If you spend a lot of time, you'll feel a little addicted, you'll feel fatigued mentally. Always follow institutional policies. Always consent your patients who are giving their permission to spread their patient testimonials. One might give the consent at one stage, but after 4 5 years, they will withdraw the consent. As a physician, it's our responsibility to withdraw the content. But if it's online, it's difficult to withdraw. So always medical legally be clear with the consents before sharing any content online. Always try to improve literacy with various modes of knowledge, like even videos, like podcasts. The Seattle Spine Foundation does webinars. The OrthoTV does, as well as the SpineTv does. All these things are very important. Give very accurate information. Don't give confusing information. Very small, accurate, in small doses information are very well accepted and very well reviewed. There are various guidelines by various societies, what to do, what not to do, do's and don'ts. You can follow them. And this is very interesting from Seattle Spine Foundation itself. I came across few days ago. They seen a question and answer over the cerebrovascular disorder, and with the post webinar, 40% of the physicians, they said that their thinking ability or their decision making ability post webinars have changed. So that is really making impact that our as a physicians, if any webinar or if Seattle Spine Foundation or OrthoTV or any other educational platform is making a decision making practice changing guidelines and influencing them, that's a real win-win for me and for every one of us if we create that kind of awareness for the physicians and in terms of in future for the general population. And as you are, if you want to grow, there should be always, we'll go above and beyond with the networking and collaboration, and all these things will help in our research dissemination, spreading the knowledge, and it will spark the discussions. Again, these are few guidelines by various societies, NAS or American Pain Society, or all these societies. They discuss about spreading the knowledge, how to do it. So as a spine surgeon, it's very important for us to have a pre-op planning, intra-op planning, and how to follow up the post-ops. Creating content is the same. We should have a very good script. We should have minimal words. We should have good thought process, what message we want to give. interrupt the sound and the lights work is very, very important. Good sound, good lights are key for the success and spreading the knowledge. And once it's ready, when should you release it? I personally feel the release time should be when you are most active. It's not morning, it's not afternoon, it's not evening. The most important time for the release, where 1 or 2 hours you are active and you have the maximum engagement, that should be the time of the release. And the more you engage with your audience, the more response you will get, the more algorithm will choose you to spread the knowledge. So within 1 or 2 hours of the release, that should be the maximum engagement you should have. Short 60 seconds, no kind of professional language, simple words, simple language should be important. There should be hook, there should be call to action, and at the end, in that 60 to 90 seconds, you should have a conclusive message. Okay, this is to be done, and this is should be understandable to all the general population. No need to show all your whole body. Even just the face and shoulders is more than enough. Most of the people, they don't play the sounds, they use the just follow the caption. If you're putting a video, always have a caption. Those who are not using the audio can read the caption and get the message. Lights and sound we discussed already. And if it doesn't, as I told you, it doesn't need much money, it doesn't need cost. All I use is the edit app from Instagram. There are various apps available, paid, they are paid, unpaid. The edit app in Instagram is free. It's very simple app. I create the videos. Like I was very fortunate and lucky to be part of the social media committee of the Sclerosis Society, as well as I have volunteered for AO Spine Society Australia, as well as Society for the Minimalism of Spine Surgery, Association of Spine Surgeons of India. So all these societies, I work closely to create more awareness. So what I do is put the video, record the video, put it online. Before put it online, put it in the edit app, put the topic of discussion, put the captions, and with the best audio, best captions, I put that on the social media. Again, once this is done, I also put a lot of related topics which are discussed, current trends about not to manipulate your neck, not to get hammered on the neck unnecessarily. If there is any event going on, ice hockey match or cricket match, and someone gets injured, I just not the discussing about the player or the sportsman, but about the injury, how this happens, how it could be preventable, what are the management options. So staying current to the trends, all these things are we can do, so that the awareness could be spread about these conditions. And to coming into the last part of the discussion and the talk, AI is definitely coming in every field, and not just in social media. With the artificial intelligence, we can create more and more high quality content, spread more awareness. The augmented realities for patient education, the surgical cadavers, and all these things will come in picture, and that will definitely help for the patient education. As a global surgeon, as well as being involved with various societies, I feel there is a huge vacuum we have to fill, the huge void we have to fill. And we, as a spine surgeons, come together and create campaign about creating more and more awareness about the spine ailments and spine pathologies that will prevent the disease and overall burden of the healthcare system of the spine ailments and spine pathologies. So just to close on, I always believe as spine surgeons, we should heal beyond the operating room and our clinics with the knowledge, with the compassion, and with the communication. And if you don't tell our story, someone else will, and their story may be wrong. So with that, I will conclude my talk. This is my Instagram account, and we are more than happy to collaborate with SpineTv, OrthoTV in future, and looking forward for more and more collaborations with Seattle Spine Foundation. I really thank Professor Raj Chapman for giving this wonderful opportunity. Thank you so much.
Thank you, Dr. Sakhrekar. Great job, again, identifying some of the key messages, providing tangent, practical points, and just a big picture perspective, literally a global vision. So congratulations on that. Just a quick question. So how can we, in this short attention span, ADHD world, compete with like chiropractors who show sometimes, just like what you have shown there quickly, they have some dramatic videos where they do some unspeakable things to human beings with their spines. How can we compete with that? I know we do some pretty amazing things in the OR, but these are like multi-hour endeavors, and the x-rays don't mean much to the population. So how can we compete with the shock value in a TikTok 60-second world?
Yeah, so like we as a spine surgeon love the attention to the details, like very much details. But that's what not general population might like. The attention span is so small. So there is something called hook, where you need to get the attention of the general population in that first 3 to 7 seconds itself. And in that hook, maybe ask a question like, do you know what do you want to know? Do you know this? All this in 3 to 6 seconds, create a hook. Like, do you know patient how this patient got stroke? Do you know what is ankylosing spondylitis? Do you know what is lumbar canal stenosis? Do you know? So that's called creating the hook. And once you create the hook, the audience will get hooked, and then you create the awareness message. What are the things? And after talking about 45 or 30, 40 seconds in that small message in one liner, simple language, you last 15 to 20 seconds, you keep it to tell the conclusive message, that call for action, we call it, that this should be done about this condition. If just to give an example, if we are talking about the most common condition, the lumbar stenosis, I will ask, are you suffering from leg pain, claudication, or difficulty in walking long distances? That's the hook. Then you talk about what is lumbar canal stenosis, all the signs, symptoms, or what are the investigations to be done. That will take 20, 30, 40 seconds. And we tell in third part, what are the treatment options available for it, and whom you should visit, all these things. So all we can do in a little bit of 60 to 90 seconds. It's a little difficult, but you'll get, as we know, when we start operating a micro disc, first time it will take about 2 hours. When we operate more and more, at the end of the 1 year or 2 year, you will operate in like 20, 30 minutes. In the same way, I feel social media handling will be, when you start making this content and things, it will be longer videos, but the way you handle it, the way you more get experience to it, you will make a shorter and more commanding and understandable content, I feel.
Then a final question I'm going to have to stop is ethics. So you brought up ethics. Patient testimonials are widely used. They can be readily abused. You can have horrible disasters, and that one great, glorious case that turned out well in a good-looking patient somehow ends up on social media. What are the ethics about patient testimonials? What do you think about them? And where are boundaries? How can we use them in an efficient but also above board fashion?
Yeah, so again, every board, whether it's practicing policies in Canada, or institutional policies in Canada or North America, US or Australia, they varied very, very, very differently. But having the confidence of the patient is the most important. Only if the patient agrees and they want to do it with the full consent, then only you should go ahead. Otherwise, sometimes we had a scenario where parents gave a consent for putting content on the social media when the kid with the scoliosis was 14 years, but when the kid grew up about 18, 19 years, they were not comfortable content on the social media. Even if we were legally safe, as a responsible physician and surgeon, we have to accept the request of the patient and get down the content from the social media, take down this content. Even though once it's put, it's difficult to take it out from everywhere. Some places it will be still there, but these policies, this confidentiality, the consents are very, very important, and we have to respect the institutional policies, the patient policies, as well as your medical board policies. And of all, the most important is the policy, the consent, and the confidentiality of the patient. That's what I think.
Well, we have to end here. We certainly enjoyed seeing you, hearing from you, hearing your thoughts. You've done an amazing job as a young surgeon, just going into the new frontier. I know tomorrow has arrived. It's now officially, I think, February 19th for you, so it's after midnight. But thank you so much for taking the time to educate us and sharing your thoughts and vision with us. And hopefully we'll have many occasions to celebrate and exchange our ideas in the future. So thanks so much, Raj.
Thank you, Raj Chapman. Thank you.
Have a good night's rest. Thank you. Take care. Bye-bye.
Recording stopped.